In order to affect the health of the whole population, it's not enough to focus just on biology and behavior. We have to think about the social conditions people are living in. People smoke, people overeat, people don't exercise, people don't go to the doctor regularly. And it would be so easy to just say, that's because people are irresponsible.
We're not in a good place today. There are tremendous inequities in public health, and that has to do with what's often referred to as the social determinants of health. We've got to think about housing. We've got to think about jobs. We've got to think about transportation. So it's time to look not just at health in a silo, but to work across all of these different systems and structures.
As a state university that is publicly funded, we have an obligation to affect the change in the health of the public.
The idea of an equity and social justice approach to public health is that we really commit ourselves to closing those gaps, to creating equity that will reduce those disparities in outcomes. But the truth is we have to do it across almost every issue.
This big idea is with and for the people of New Jersey. It is all about the people of New Jersey. It is all about improving the health of the people of New Jersey.
One of the key features of our approach to public health is that we want to involve many sectors that don't always work together.
Rutgers has the capacity to be an incubator for this really, really exciting idea. We're going to do the workings here and develop a model that's going to show the rest of the country and the rest of the world how you can actually do this.
I think so much of what an equity and social justice approach to public health shows us is that when we allow people to articulate what they need and want, we're going to get there. It's really approaching people as the solution, not as the problem.
Good afternoon. Thank you for joining me and viewing that powerful clip. It's my distinct pleasure to be here today to talk with all of you and our Rutgers partners and experts in depth about that solution. My name is Katie Mayfield. I'm the Director of Development for the Rutgers School of Public Health. A few housekeeping items before we launch into our discussion for today. Audience members, you are automatically muted for the duration of the event, but we still want to hear from you. Please use the Q&A feature at the bottom of your screen to submit questions, which we will be monitoring throughout this presentation. The last half of the discussion will be devoted to questions from the audience, and we also have questions that some of you submitted prior to the event. You can also join the conversation on Twitter by searching and using the hashtag AdvancingUrbanPH, and I'll throw that into the chat, AdvancingUrbanPH, during and after today's event. Finally, before I introduce our moderator interlocutor, who we are so lucky to have today, I wanted to take a moment to acknowledge some heaviness of this time. First, to acknowledge the losses we have all suffered in distinct ways during the past 15 months of a global pandemic. Secondly, to recognize the one-year anniversary since the murder of George Floyd and the ensuing racial reckoning we have experienced in our country that has affected our communities in many ways. And finally, to elevate the historical and continuing work of the communities of Newark and our partners at Rutgers Newark towards the shared goal of improving access to healthcare and reducing health disparities in our communities. Please join me in a brief moment of silence and acknowledgement. Thank you. Now it is my distinct pleasure to introduce our partner and fellow leader in public health equity, Michellene Davis. Named among the top 25 most influential minority leaders in healthcare in the nation by Modern Healthcare magazine, Becker's Hospital Review Top 50 and Top 65 African Americans to Know in Healthcare for her public health-centered track record of policy successes, Michellene Davis is the new President and Chief Executive Officer of the National Medical Fellowships, Inc. Founded in 1946, NMF was one of America's first diversity organizations. Today, NMF remains the only national organization solely dedicated to providing scholarships to medical and health profession students in all groups underrepresented in healthcare. Ms. Davis comes to NMF from RWJ Barnabas Health, the largest academic medical center system in New Jersey, where she served as the Executive Vice President and Chief Corporate Affairs Officer. Ms. Davis created and led social impact and community investment, an equity-centered, policy-led community health practice dedicated to addressing the social and political determinants of health. Before joining RWJ Barnabas Health, Ms. Davis served as Chief Policy Counsel to former New Jersey Governor Don Corzine, where she was the first African-American to serve in this position in state history. She was the first African-American and only the second woman to serve as acting New Jersey State Treasurer, responsible for a state budget of over $30 billion. She was the youngest person to serve as Executive Director of the New Jersey Lottery in state history and served as a Senior Policy Advisor in the New Jersey Department of Health and Senior Services. Ms. Davis began her legal career as a trial litigator, is an honors graduate of Seton Hall University, and holds a Juris Doctorate from Seton Hall School of Law. She holds executive education certificates in corporate social responsibility from Harvard Business School and in social impact strategy from the Wharton School of Business. Michellene, we're so happy to have you here today. Thank you.
Katie, thank you so much for that very kind introduction. I was trying to turn my camera on in order to get you to stop sooner rather than later. I am so excited in order to be here with this particular audience on today and with the incredibly bright minds and outrageously compassionate hearts of your panelists. It is really an interesting time in history, both as a country and as a globe. Here we are, finding ourselves amongst literally a global pandemic and an international reawakening around racial and social justice. And there are many individuals who are really trying to figure out, what do we do now? There are statements after statements being issued by corporations and other nonprofits, but the individuals on our panel today are those who have been leading a blueprint for others to follow. Indeed, as mentioned in the video by Dean Halkitis, really, this School of Public Health is creating a model that welcomes all others to acknowledge, adopt, adapt, and succeed in because of the thoughtful deliberation of these two panelists. So I am going to introduce them. They are friends, and I cannot wait for them to be on the screen with me. But more importantly, it's because I know that you too are excited to see them. So first, I'm going to begin with Dr. Leslie M. Kantor. She is a widely recognized public health leader, a researcher, an educator, and an advocate. She currently serves as the inaugural chair of the Department of Urban Global Public Health at the Rutgers School of Public Health. Her current projects include efforts to create health literate messaging related to COVID-19, reduce severe maternal morbidity and mortality in Newark, New Jersey, evaluate new approaches to preventing adverse childhood experiences, and increase health equity. Dr. Kantor was formerly Vice President of Education at Planned Parenthood Federation of America and a member of the faculty of the Michellene School of Public Health at Columbia University. She has served on the boards of a number of national organizations, including ETR Associates, the Mexican American Legal Defense and Education Fund, Power to Decide, formerly the National Campaign to Prevent Teen and Unplanned Pregnancy, and Answer. Dr. Kantor is the recipient of numerous awards, but I will mention she is the 2020 recipient of the Alan Rosenfield Alumni Award for Excellence from Columbia University's Michellene School of Public Health. Please join me in welcoming Dr. Kantor. Thank you, Dr. Kantor. Now I have the distinct honor and privilege of also introducing Dean Perry Halkitis. Dr. Halkitis is a public health psychologist, an infectious disease epidemiologist, researcher, educator, and advocate, but he is so much more. He is a dear personal friend. He is both an ally and an accomplice. He is a co-conspirator in tearing up regular systems in order to create true systems change to advance equity. For 3 decades, he has focused his research on the emergence of prevention and treatment of infectious diseases, specifically HIV, HPV, and other sexually transmitted infections, and more recently, SARS and CoV-2. His program of study has sought to disentangle the biological, behavioral, psychosocial, and structural mechanisms that predispose people and populations to these infectious diseases. In other words, he has literally been studying how to dismantle systemic and structural racism in all of its forms as it raises its ugly head in our society, and the synergies of infectious disease with mental health burden, including drug abuse and sexual, gender, and racial and ethnic minority populations. He currently is the Dean and Professor of Biostatistics and Urban Global Public Health at the Rutgers School of Public Health. He is the founder and the director of CHIBS, which I'm going to let him tell you about. And he's a primary member of the Rutgers Cancer Institute of New Jersey and the Global Health Institute and Professor Emeritus at the College of Global Public Health at NYU. He is a published author, and I could go on, but I want to make certain that you know about these 2 particular works. One, his 2019 book, Out in Time, The Public Lives of Gay Men from Stonewall to the Queer Generation, and his 2013 book, The Age Generation, Stories of Survival and Resilience. They are both distinguished award recipients because of the incredible work that he has done to advance public awareness and to advance the psychological recognition of all of those factors that literally contribute to the furtherance of infectious disease. Please join me in welcoming your panelists. All right. So, ladies and gentlemen, we are thrilled to be here with you on this evening, and thank you. Thank you for not closing out your day without having a chance to spend some time with us. So we're going to jump right in because I know that it is a rare opportunity to have this much knowledge, this much brilliance, and more importantly, this much heart and head at your disposal. So I'm going to jump in with our first question on tonight. And again, Katie told you that this is also for you to engage with us. We want to hear from you, so make certain that you are uploading your questions as well. We are talking tonight about the future of public health. So I'd love to hear from our panelists a little about exactly what it is that you do, despite all of the accolades in the bio, and where do you see public health moving forward? Dr. Kantor, I'm going to start with you.
Great. So to writ large, I think one of the most important things that we've seen because of COVID is that public health can't be in a silo. The reason there were such incredible disparities in who got infected and hospitalized and died is because we've got to think about health as something that is determined by housing and employment and transportation and the food system. It's not just about going to the doctor. So writ large, my work is about bringing sectors together. And very specifically, I've been working on maternal mortality and severe maternal morbidity in New Jersey. I think a lot of people are shocked to know that New Jersey is in the top highest states in the country for women dying for a pregnancy-related reason. And for Black women are 7 times more likely than white women to die in the state of New Jersey. So I literally turned in a grant today, trying to bring together all different players from the state, from the Barnabas Health System, from Newark Beth Israel Medical Center, with doulas who are helpers who help women through the prenatal period and during birth. And there's a great new policy in New Jersey for doulas that we are going to look at its implementation, but more importantly, co-create an intervention with the hospital to integrate doulas into healthcare teams. So that's literally a little bit of what I'm up to right now.
Fantastic. I love the fact that it sounds like you're getting in some good trouble, good and necessary trouble. Dean Halkitis, we turn to you, my friend.
Thank you, Michellene, for your kind words, and and for being here with us this afternoon. I was actually just sitting here thinking, why is it that in my life I have these I'm surrounded by amazing women who are also my friends, and Leslie and Michellene are 2 of those people, and I'm like, I know why, because I was surrounded growing up with these incredibly brilliant Greek women. So I'm thankful to my family for that, for bringing the both of you into my life and doing this really incredible work. I've spent, my career, fighting for the rights of people living with HIV. The last year and a half, really thinking about how COVID-19 has affected all of us. And, if COVID-19 has done anything, it has illuminated once again the inequities that exist in our society. I remember it being April or May of last year and being at an interview on some television program, probably it was Brenda Flanagan, my friend Brenda Flanagan, and she asked me, why is it that Black and brown communities are being adversely affected? And what I really wanted to say was, duh. Like Black and brown communities are adversely affected by every health condition in our society. And that's because of the structural inequities, the racism, the discrimination that Black and brown people and all marginalized people, LGBTQ people, women experience, immigrants experience in our country. So I think what I've been working on a lot this year is trying to figure out how we take these conditions and address them. COVID-19 is more than a virus. It is not simply a biomedical phenomenon. It is a phenomenon that is driven by psychological and social and structural issues. And I think what has become crystal clear to most Americans, not all, but most, is that to affect changes in health, it is not enough to focus on biology. We must address the conditions in which people are raised. Michellene has heard me say this a million times, and I'm gonna repeat it here. People don't wake up one morning deciding they're gonna have an opioid addiction. They don't wake up one morning to decide they're gonna be obese or have COVID-19 or HIV. It is life conditions that get them there. So if we want a society where everyone is healthy, we have to have a society where everyone has an equal chance. And that's what this big idea is all about.
That is absolutely accurate and true, and so dead on, so said so poignantly. Oftentimes, Perry, I have also mentioned to folks that health disparities do not naturally appear in nature. They do not grow on trees, right? No one wakes up in the morning and says, "Oh, I know today I'm going to have Wheaties and a higher incidence rate of breast cancer." That's not actually how it works, right? So you just mentioned the big idea. I would love for you to talk a little bit more about the big idea. And this new project and the way in which it is designed to really work towards advancing the agenda towards health equity.
Yeah, so thank you for that. So look, this is, one of those things in life where it's just like this idea has been percolating, I think, in my mind and in my heart and in Leslie's mind and in Leslie's heart for decades, probably, right? Just because of the work we've done, the work we've done around HIV and other diseases and people's rights. And so what this big idea does is it tries to dismantle so much of it tries to dismantle the mythology that public health or biomedical solutions alone can solve the problem. The work we're trying to do here in Newark has been going on for many, many years, built on the efforts of folks like Chancellor Nancy Kantor and Denise Rogers and others from across Rutgers Newark and the communities of Newark. And through this partnership with those individuals and with the communities, our big idea is a project that seeks to improve the well-being of people and populations by creating a community-centered public health hub, for lack of a better term, in Newark, rooted in the ideas of social justice and health equity. And that propels collaboration across care, policy, research, education, industry, and lived experience. And what do I mean by this hub? So if you can imagine, too often we think about people seeking healthcare in a hospital. They go to a doctor, they go to a hospital. Public health people are doing, counts of infectious diseases. And we are envisioning something much bigger and much more. And what we're envisioning is a hub for urban public health equity that is in the heart of Newark. And in the heart of Newark, working with and for the populations of Newark. So we are having classes there, and we are providing care there, and we are developing policies there, and we are having students work hands-on with people in public health. The term public health has the word public in it. Anybody who's doing public health work behind a computer is not doing public health work, right? That's just not the way it works. So this hub becomes an incubator for ideas that are born up from the people who need the support. People know what they need. People know what they need in terms of healthcare, in terms of prevention. So it is about incubating those ideas with academics and with industry and with public health professionals and making it come to life and letting those ideas live in the community. Too often what happens is that researchers go in, they do some work on a community, they drop something there and they disappear. That's not the way it's going to work here. I've never worked that way, and it's not going to work in this hub. So that's one piece. The other thing we have to do is we have to recognize that it is our responsibility here in New Jersey, in Newark, and more broadly in the country, to train the future workforce. So, ensuring that we have the most promising strategies that reduce bias and discrimination in any field ensures that the workforce reflects the diverse community it serves. So I think it is imperative that we continue to train scholars who are developing from elementary, high school, undergrad on into public health, and at the same time train those who have been giving from their heart and soul working at departments of health within the state of New Jersey. I'm very proud to say that a few years ago, we signed a memorandum of understanding with the Newark Department of Health that provides individuals there who have no formal public health training the opportunity to begin their public health training for near zero cost. This is a big part of this project. It's also complements our ongoing Masters of Public Health. It complements the development of an honors learning track for students in Newark that is focused on public health, and it complements a brand new DRPH that Leslie helped develop and is leading, which actually provides hands-on executive format experience and training to people who are already working public health to get their DRPH. So that's another part of this idea. And then, last but not least, I'm going to say this, the term community engaged, people say to me, oh, mental health. And I say to them, oh, you mean health, right? And people say to me, community engaged research, and I say to them, oh, you mean research, right? And we have to stop using these labels because somehow they cheapen it. But I'm going to say that what we want to do is enact research, which is community-based, where we will recruit world-class faculty to advance these ideas. And this is done through a model called community-based participatory research. But at the end of the day, it is research. And what this approach does, it provides experts in diverse issues affecting the public health, ranging from gun violence to environmental justice to maternal and child health. And we are committed to developing these individuals, these scholars who reflect the beautiful diversity of our state to become leading educators and researchers. The Hub for Urban Public Health Equity will be the center of this. And I've said to Michellene a million times, imagine in the South Ward, a building that's just sitting there that we go and immerse ourselves in and work with people in real time. Our students are craving this. Leslie and I are craving this. Newark needs this, and Newark needs to become the model for the rest of the country, and we're going to do it with this idea.
That is so fantastic. That is so fantastic. Leslie, comments?
We are starting to do it, right? This is the work that Perry and I have been doing. I think that what we've been able to do over the last few years by engaging directly with the community is to really hear what it is that Newark and the existing institutions need. So we're not coming in with our idea and imposing it, right? But rather this has come out of our approach to really seeing what's missing. And, academia can play a very constructive role. It's not about, though, being apart from the community. It's about being in the community. And then we are so well situated as a convener.
Yeah, that is so incredibly important because of the sort of old adage of build it and they will come is yesteryear, right? It's also keenly important to acknowledge and understand, and I love this about what you're saying right now, that academia and the community are actually on equal setting. These individuals have PhDs in their lived experience, that no matter how many papers have been published, no matter how much research has actually been done, there is no exchanging the value of that lived experience. And so I love the fact that you're really looking to center the voice of the community, right? Rather than just invite them into the room in order to tell them what it is that you've researched and found out, or what data tells them. I think that is fantastic and incredibly important. I'm so grateful for this dialogue and this incredible conversation. Perry and Leslie, there was an aspect, oh, I'm so sorry, Dr. Halkitis and Dr. Kantor. There is an aspect of that beautiful slide that you showed that also talked about the pipeline, right? So can we talk about the pipeline for a moment? You know that that's where my heart is as the new president and CEO of National Medical Fellowships. If in fact we know that Black babies live longer when they have Black doctors, I am like that we are going to make more Black doctors, right? We are going to make certain that more Black and brown communities are really in there, and that there are doors that are open for them. Talk to us for a moment about your focus and the big idea on the creation of that pipeline and what it is that you see for the future.
Leslie, you want to take that one? Start it? Yeah.
Yeah, one thing that I think the pandemic has changed for the better is that it used to be that nobody had heard of public health. So when they thought of health professions, they thought of, nurse, doctor, clinician. And we actually started a camp for high school students several years ago to try to shift that. And again, high school students, many from Newark and from across New Jersey. So we're trying to let young people know sooner about public health as a health profession. We are one of the most diverse schools of public health in the country already. But we know that for many young people in New Jersey's communities, the tuition is still prohibitive. So we are trying to, through this initiative and our work, make sure that there is ample scholarship money. And I'm going to I'm supposed to wait till later to say this, but Perry has a vision that we will become the first tuition-free school of public health in the country. It fits into the conversation now, so I'm going ahead and saying it. But that's because of our overall focus on equity, and that means equity of opportunity. And not everybody comes from a background where they can afford even a public higher ed tuition. It still is relatively expensive and foreclosed to many people. So that's some of what we're up to.
Okay, if I could just thank you for that, Leslie, and if I could just add a couple of thoughts to that. I was raised by parents who came from Greece and had a 6th grade education, and did the best they could, right? But I didn't know what my options were. I was like a first-gen scholar, and I had to figure it out. You know what my commitment is? I don't want other scholars from families where their parents have limited educational to have to struggle that way. I want to make it easy for them. I want to find those young African-American or Asian Pacific Islander or Latinx LGBTQ students who are in elementary school and high school and provide them with a clear thoughts and direction on what their future could be, because many don't know. Many they hear health and think, oh, they think what I thought, which is, oh, I have to be a medical doctor, which is like the last thing in the world I wanted to be. And I somehow stumbled into this place, and I was lucky enough to stumble. I want to make it so that these students, these future students, these future scholars don't have to stumble into it, that we are providing them the direction. And if we do that, then we have an amazingly diverse student body, but we will then also have an amazingly diverse faculty that reflect the student body, because yes, hello, but that starts by creating this pipeline, and the pipeline from the community, from schools, from industry, and you bring people in. Like, look, I'll tell you, like, Leslie was not a traditional academic, and I knew she'd be one of the greatest chairs of all time, and she is, right? And so we get to think outside the box. We get to color outside the lines, and in doing that, we get to shift the paradigm away from this very traditional way of thinking about public health.
Hear, hear. I love the fact that you are approaching this in a manner that evidences the assets within the community, right? So often, so much of the research really approaches community as a deficit-based entity. And we know that not to be so, right? Because if you can live, most individuals refer to it as the social determinants of health. Some are saying the social influences of health. Traditionally, I've talked about it as the political determinants of health because of the fact that so much of the design of the system that promotes really healthcare disparities has come from systems and laws and statutory language. You know, we know this to be so. I know that we have a question in our chat box from our audience, and I'm thrilled that we are engaging in this manner. And so let me say this again to the listening audience. You are participants in this panel as well. This is supposed to be a colloquium, and so I want to make certain that you are talking one with us as we are talking with you. So I'm going to read to you this particular question. What can companies do to help with improving equity for underserved students?
You want
what
to start?
Can companies do?
You want me to start?
Sure, absolutely. I may jump in there too.
Well, you know, so to become the first free tuition school of public health, which is the model that I basically stole from my old place, which we created the first tuition-free medical school. You know what that is. I will not name that institution because I'm a Rutgers person now. It requires that company put the money where their mouths are, and it means that you have to then invest in public health as much as you invest in medicine and in dentistry and in nursing, and make public health an equal partner. So companies can support our initiatives by helping us recruit students, like students who, you know, might be recruited by other institutions because they offer more. We want to keep the best and the brightest from New Jersey and beyond in New Jersey, right? And that requires money very often. So this idea of a tuition-free school of public health, which I think can be a reality, I really, really, really do, can happen if companies invest in this idea in real and meaningful ways. And we've begun to do that thanks to our leadership council, people like Liz Brewer, who may be in this conversation with us, who've begun to provide us with full scholarships for our MPH students. That's what needs to happen in one part. But I know Leslie has more to add to that.
I do. I have a couple of other thoughts. You know, we do have a lot of students who want to work in industry. So also coming to us and thinking about internship opportunities and doing it differently. And I actually see that the question came from someone who's a great champion, Atiba Page, who's actually already been partnering with us on this big idea. And I think I would just lift up that the Black leaders in all of these New Jersey companies, I think the more prominent people like Atiba and Michellene are, it's so important to our students. I just think of Marian Wright Edelman, and she always says, you can't be what you can't see. Mm-hmm. So we really need, you know, I think in companies, I feel like everybody's starting to get it, at least. And so we really need to make sure that our young students of color meet leaders like Atiba and Michellene.
Well, thank you so much, Leslie. That was really very kind. I'd love to add to that as well, since I have been one of those underserved students, if you do not mind. And I think that, you know, internships are wonderful opportunities. I really want to make certain that they are offering paid internships so that you get the best and the brightest from areas of the state, like I am from, like Camden, New Jersey. I always tout that. I love the fact that I come from the city that for a long time was literally labeled the most dangerous city in all of America. I often said to folks in corporate, don't come in here for a fight because you're bringing a paperclip to a gunfight. But what I really love is the fact that that companies can really match their statements that they've issued, or these courageous conversations that they're having on webinars, by really, as Perry said, putting their money where their mouth is, right? Sponsoring these students in a real and deliberate way through an internship program, and then, quite frankly, marrying it to furthering their education at this particular institution, because the uniqueness of this School for Public Health is not just the fact that they are jumping on the bandwagon to talk about equity, but that they're doing it as well through a social justice lens. So if we could talk about that for a moment, I'd love to do this. Let me read to you from the American Public Health Association's statement on social justice. And then I have a question as to how, Leslie and Perry, you see social justice fitting in with the big idea. And I quote, social justice is the view that everyone deserves equal rights and opportunities. This includes the right to good health. Yet today there are inequities in health that are avoidable, unnecessary, and unjust. Think Flint. These inequities are the result of policies and practices that create an unequal distribution of money, power, and resources among communities based on race, class, gender, place, and other factors. To assure that everyone has the opportunity to attain their highest level of health, we must address the social determinants of health and equity. It does not stop there, because this is the most important part to me. Racism and other forms of structured inequity sap our potential to become the healthiest nation. Racism is a system of structuring opportunity and assigning value to individuals and communities based on race that unfairly disadvantages some individuals and unfairly advantages other individuals. Racism and other isms are forces that determine the distribution of the social determinants of health. So with that, I'd love to hear from you about why it is that you chose to include social justice, right? Because you could have done as many other schools are doing and turned your head and looked the other way. And the way in which you see social justice squarely fitting your big idea.
I'm going to start by saying, I don't think Leslie and I had a choice, right? It's just who we are. You know, Leslie and I have our roots in ACT UP. You know, like this is where it all started for us when we were young, when our friends were dying all around us, when the government wasn't paying attention, when people were telling us that gay people are sick and horrible and they deserve to die. And we were on the front lines there fighting for that. And we recognize that the forces that shaped that pandemic have shaped every health problem that we see in our country. And the problems that, you know, that communities of color face. You know, it's like no coincidence that you look at the HIV epidemic in the United States right now, and who are the people who are most at risk in getting infected? Young, Black, gay men. Gay and Black, often poor. You put those three things together, you create these intersectionalities, and it's because of the policies and structures that are in place that one, allow discrimination to happen, allow policing to happen the way it does, and perpetuate and provide this limited access to means to succeed. I want to say one more thing, Michellene, because I think it's really important. It's not just healthcare. I mean, these policies and procedures are the things that exist in academia that keep scholars of color from succeeding. And, you know, we have to like just kind of bomb those things and start from scratch because it's not working, kids. And so our job is, from a social justice perspective, first of all, as two white people, I'm going to say this right here, right now, right? To like say, we're going to own our privilege that we have gotten because we're white. Right? Yes, I'm gay. And yes, I was immigrant parents. But at the end of the day, I was a white man and a gay man who could pass as straight. And so I didn't have to face lots of those issues, right? And I own that every single day of my life. So now it is my obligation to be in the front line and take the punches to change the system that is keeping Black folks sick, Black folks untenured, Black folks from becoming presidents of the United States, and every other role that Black and brown people need to occupy. And that's why it's just, social justice is just who Leslie and I are.
Yeah. Leslie, I don't know if you have a comment back to that, because that was so salient and so exactly, I mean, I felt that in my soul knowing you both.
Yeah. You know, ignoring social justice is what has gotten us to this point. So it's sort of like, if you always do what you've always done, you'll always get what you've always gotten. I mean, if we don't center social justice, we're just going to keep recapitulating the same inequities, the same disparities, the same problems. We're not going to move forward. So it's the core. It's the core. It's not an afterthought. It's not the sprinkles on the top. It's the core of how we approach the work.
Yeah, that's exactly right. And I love your enunciation thereof. I think I like to say that social justice is a recognition in healthcare. It's a recognition of and an understanding of the way in which the criminal justice system and the educational system, right? And voting rights and voter suppression and the electoral college and everything else really comes together in order to really position us in a way where we have to continue the fight of bringing about equity. We've got some really great questions in our chat, and so I want to call these out to you. So I love this, and actually, Perry, you spoke to this just a moment ago. Historically and contemporarily, the academic enterprise is dominated by white scholars, and that contributes with structural racism or to structural racism. What is your vision for engaging scholars of color in academia, and what do you think is their role?
Oh my God, what isn't their role? So, one, it is my job as a dean to help identify those scholars. Number two, to convince them that we're an institution where they can succeed. Number three, to establish the parameters within our school and our institution for them to succeed. And four, to make sure they are in the pipeline to become the leaders of this school in the future. That's what I envision as the role. Number two, I want to say here, and I'm really proud about this, like so proud of this. I'm getting to work with Linda Alexander, who's at West Virginia University right now, and we're ASPPH, which is the Association of Schools and Programs in Public Health. We're putting together a document about how to dismantle racism and structural racism in schools and programs in public health. And we are putting together a toolkit for people to use it in their institutions. Our school is like so ahead of the game. Last week, we actually reviewed and implemented a document that we're going to ask every faculty member to undertake, which asks them to assess diversity, equity, inclusion in their syllabi and in their teaching, which is incredible. It's not a punishment. It's not like, it's a self-check. Do you have scholars of color in your readings? Are you addressing issues faced by underrepresented groups? Is there a bias in the way you're teaching the material? Are you ensuring that assessments reflect the diversity of learners in your classroom? And this kind of shuffling and rethinking, one, allows students to succeed, but number two, empowers scholars of color who are teachers, right? To know that their voice matters, right? Because actions matter. And so those are two things that I think are really central to the work that we're doing.
Hear, 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 hear. I do have another audience question. And so I'm going to throw this over to you, Leslie. Can a stronger basic teaching and SDOH from a public health lens help healthcare professionals to seriously view primary prevention as much a valued part of medical care as intervention and treatment? I've got some answers to that one too. Yeah.
Yeah, I mean, this is, the way our entire healthcare and public health system is in this country is completely skewed, right? I think it's about 90% of the money goes towards treatment and 10% towards prevention. And then a pandemic comes along and shows everybody why that's a mistake. I think that it takes revaluing in many places. I mean, I think the curriculum is one place. I also think that it's our elected leaders, our public health organizations, everybody on this call. We should all be continuing to shout from the rooftops, not waiting for an emergency to say, we've got to shift things. Everybody would rather be well, right? And just need a little health care once in a while versus putting all of the money and all of the focus on waiting until somebody's riddled with cancer, right? Before we start thinking. We really need to be thinking about, can people walk in their neighborhoods? Who's getting exposed to too much pollution? What kind of food is available? And if we can shift that through society, I think then we kind of pick up everybody. I don't think it's that we just need to convince any one sector.
Can I just add to what Leslie's saying? I think it's really important to say, we're not saying like the bad MDs need to be cast aside. What we're saying is what our friend Laurie Garrett said at our graduation speech this year, which is like, public health is an equal partner. We're not lesser, we're not other, we're equal, right? And I'm going to say what I'm going to say. You know, this notion of population health, which evolved, I think, frankly, is just a reaction of the medical profession to do public health work. Well, how about just work with us? How about you keep us on equal footing and work with us and try to collaborate with us? Because as Lori said in her graduation speech, one of the things that was so problematic about the development of contact tracing and the spread of the disease in New York City was that instead of going to this amazing Department of Health, the greatest Department of Health in the history of the world, the mayor chose to go to the hospitals, and it was disastrous. So doctors, MDs, work with the PhDs, we're your equals.
Yeah, I cannot say that all the more. I will tell you, I literally, in this new seat of being the president CEO of National Medical Fellowships, had a conversation earlier today and heard about a student who was in medical school who throughout her entire tenure literally had to keep fighting to remain with a focus in primary care. And that is because of a stigma that was really raised around it. But she literally kept saying, because for her, it was a way to really practice public health through in a clinical method. I sincerely believe that one of the chief ways of doing this is to make certain that every medical student literally has to take public health courses and that they are literally held together. We cannot do this alone. We sincerely need to make certain that our public health PhDs are side by side with us. We have a fantastic question that has just come in as well from Giselle Clemens, and I wanted to read this in particular. It says, I would love to hear more about the coalition building necessary to create the big idea and how that will play out in its implementation. She loved that the approach will be led by those with PhDs in their lived experience.
Leslie,
Sure.
go.
I'm happy to start. I mean, I think Perry and I spend all our time in conversation with all of these different constituencies in Newark and across the state. And, you know, part of what you have to do is that you have to be willing to show up for issues that aren't necessarily your issue. Like I spent most of my career doing sexual and reproductive health. But they needed somebody to come and be on Mayor Baraka's guaranteed income task force. I learned a ton and I met a whole other group of people who I wouldn't have known. Right now, I'm talking to Black women about their experience giving birth in Newark, and a set of women are going to become community researchers partnering with me to talk to other Black women. So it's community members, it's community-based organization, it's local businesses, it's our corporations, so many of whom are represented here, it's our foundations. You know, we need everybody working together, and that does not happen nearly enough. There's a lot of lip service to that. I was thinking about that when I was putting together letters of support for this grant today, that these reflect real relationships, not just I found somebody on the internet and asked them for a letter. It's like, these are the people I've been talking to for the years since I came. And that's what's going to make any project go.
Leslie, thank you for saying that word relationships, because it's all about relationships. It's, you know, it's about working with and for the people of Newark. It's about not using the term those people, them. Ugh, stop using that language. It means that when you'd rather be home eating lunch today at 12:30, relaxing or doing a spin class, instead what you're doing is talking to Greek Orthodox priests about how they open their parishes, you know, in light of COVID-19, while sort of respecting their tradition and having those difficult conversations. It means that when NJPAC calls you and says, Perry, we need you to be on our diversity, equity, and inclusion committee, you say yes. It's all about bridge building. It's all about trust, and it's all about relationships. And if we do that well, which I think we've been doing, the folks will come to the table naturally. And it's about being at the table and giving equal voice to that mother who has 4 children, who's had trouble with labor and has a high school degree, as the MD PhD at the other side of the table. That's what it's about. That's how you build it.
hear, hear, and the knowledge that if that MD, PhD at the end of the table is also an African-American woman, their health outcomes are actually totally analogous. So I love this piece about partnerships and relationship, and Perry, that's really how you and I got together and did the right racism of the public health crisis for entities in Newark and then the rest of the state. But I really want to ask this question too. So for those who are not already partners or already part of those coalitions, how can people get involved?
Yes, Leslie, you see
being here.
Yeah.
Being here today is part of it. And I see people actually chatting in, and I'm very excited to get more connected with the alumni. I think that there are lots of different ways. And some of you, based on who you are, you're going to right now are probably thinking about ways that you could connect with us and be helpful. But a couple of really specific things. You've heard our vision about having an actual space in Newark. We've got space right now by Newark Penn Station, and we've quickly outgrown the whole thing. Plus, we would rather be truly in the community. And again, the idea is to be a place where community groups can also meet, where we can provide healthcare. We could be a vaccination site right now if we had this space up and running. So that's one thing that we would love support for. You can support scholarships. And, you know, a lot of people hear support and they think that they have to have a lot of money. The truth is, one good thing about Rutgers as a public school is you don't have to have a ton of money to be able to support scholarships for our students. And sometimes even a little bit goes a long way. Sometimes students can come up with the tuition, but they don't necessarily have the money for books, for example. So there's no amount too small to make a difference in somebody's life. And then we've talked about the importance of more scholars of color, more scholars who do research that has not been traditionally valued by the largest funders in this country, like the National Institutes of Health. So we've called out community-based participatory research, or as Perry likes to say, research. But it is true that, you know, bench science and, you know, we all right now are so grateful to people who, for example, figured out the mRNA vaccines, and those are terrific. A lot more money goes to that kind of research than goes to the kind of research that I do and other scholars like me do. So we really are trying to attract top talent. And I will tell you that we've had some terrific candidates who we have tried to attract from private schools, and it is sometimes very challenging to compete with the kinds of packages that those institutions can offer. And we shouldn't be asking scholars to actually take a pay cut to come and work with us. We ought to be able to offer them something very competitive. So those are the concrete ways. Obviously, we are also really interested in hearing your ideas, in your intellectual capital, in your involvement, in mentoring our students, offering them internships. So we are open to any of the different ways that you want to engage with any and all pieces of this.
That is so incredibly fantastic. I'm delighted to see the way in which the audience has been all engaged in all of this. And thank you so much, Perry and Leslie, for everything that you've been doing thus far. Thank you for your partnership. Thank you for your collaborative heart, really. And thank you in particular as an individual who comes from the communities that we are really conscientiously aiming to serve in Newark and throughout the rest of the state of New Jersey. Thank you for the way in which you envision, understand, and receive our asset-based presence. I thank you for that, right? It's a rare thing to hear from scholars the real importance of seeing our humanity. There's one final question that I really want to ask from Melanie McDermott. It was sent in advance, and I think it's something that we should answer. How will this new initiative connect with and leverage the imminent RU Climate Action Plan? The interim reports express the intention for the plan to enhance climate resilience and reduce inequitable climate impacts through community development and engagement.
It's completely aligned with that. You know, it's like a natural extension of that idea. You know, the climate, people's physical space, their shared space is not separate from their physical bodies, is not separate from their communities. And so we are fortunate at the School of Public Health to have a really amazing I will actually say this. We are the first school of public health in the country to actually have the word justice in its environmental and occupational health and justice department, right? The first, I think, then the only still. And so that unit is building on this idea of the big idea in developing programming and research around environmental justice that is completely aligned with that programming. So it's a natural extension of this whole big idea.
That's fantastic. I've got a question. I think, Leslie, this is really for you. Both how will Newark residents actually benefit from this, and how will Rutgers measure and assess their resident impacts, right?
Yeah, terrific.
If it doesn't measure, it doesn't matter, right?
Right,
So
right. What gets measured gets done is sometimes
right.
how we talk about it. So as you heard, actual people from Newark are the people who we are talking to, who we are engaging as community researchers. And of course, as we change systems and structures, the whole point of that is hopefully to make a real and measurable difference. There are obviously all different levels at which you measure that, right? Did you do anything? How much of it did you do? And then did it make any difference? I actually just a couple of weeks ago finished up a report on disparities in the top 10 causes of mortality in Newark for University Hospital. And you see disparities across, unfortunately, every single issue. So ultimately, that's what we should be held accountable for over time. It takes a little bit of time, but if we can't start to actually close the gaps and achieve some equity, then our work is simply not done.
And you also measure it by how effective are you at recruiting, underrepresented minority PhD students and getting them to succeed and placing them in actual faculty positions. I have spent my life doing this. And I am so proud when I look around at all the institutions around the country where all these scholars are that I've worked with. That's what we have to do. It would be 100% amazing if we could have a class of like 5 scholars from underrepresented groups who are PhD students who within 5 years' time are in institutions all over the country doing the good work. That's how we keep ourselves accountable. And fortunately, this dean guy is like a measurement guy. So he lives for the numbers. And that's what we do every single day. We also, Michellene, and Leslie, I think would say this too. We do the work, we realize that some things will work really, really well, some things will work less well, and there's no shame in saying something didn't work and starting again. That's what it means to be a good scholar.
That's exactly right. And so I look forward to continuing to co-design together with that, and with our heartfelt thanks to you both. I am going to turn things back over to the incredible, incomparable, extremely competent Katie Mayfield.
My job is easy after that incredible discussion. I really think that I just want to elevate one of the comments that came through in the chat to close us out. And this is from Michelle Famula. And she just said, thank you so much for this discussion. It was exactly what I hoped it would be. This is a wonderful direction for Rutgers and Newark and the School of Public Health to take. I think this is the proudest moment I have been in my institution's attention to the community since its work with pediatric HIV. Michelle, thank you for sharing that. I also feel the same way. And I just want to thank our incredible interlocutor, Michellene, for leading the discussion. And of course, to Dean Halkitis and Dr. Kantor for their incredible work and partnership with Rutgers Newark on this initiative. Please, to get involved and to stay in touch, I have included my contact information in the chat. My email address is there. You can reach out to me and I will route you to the correct area to get involved. And just as a final remark, this event has been recorded and attendees will receive the link to the Rutgers Alumni YouTube channel following today's event. Please stay safe, reach out, and connect with us soon. Good night.